Good evening, Dr. Ramstetter and my fellow students. This is my friend Andrea. We are around each other quite a bit. She's a part of my small circle. So we are going to do this role play without wearing masks. Obviously, if I was a real home health nurse to make a visit, I would be wearing a mask to see her. So we're ready?
Yes.
Okay. Good evening, Andrea. My name is Lori Foster, and I'm a home health nurse. Your OBGYN office suggested that I come visit you because we know that you have problems with transportation and you've missed a couple of office appointments. So I'm just here to check in on you. How are you doing today?
Everything's been going really well. I mean, it's a little stressful living here. I'm sorry for the noise and the dog and all the kids and stuff.
There's a lot of people living in this same little space, and I can understand how that would be really hard for you. But otherwise, are you feeling all right? Are you tired? Are you eating okay?
Yeah, I've been eating really well. And yeah, I mean, I'm tired, but I think it's normal.
That is normal. Just like every other pregnant woman, they'll tell you. I felt that same way when I was too. It's been quite a while for me, but it felt the same way. Now I do have a question for you. You have been smoking. You're a smoker. I saw that in your medical history.
Yeah.
How often do you do that?
Oh, about a lot. 8 or 10 cigarettes a day.
Oh, well, that's actually not too bad. I've heard a lot of people that smoke a lot more. Is that a habit that you've had for a while?
Especially since we all moved in here together, it's a good excuse to get out of the house.
Oh, true.
Because I don't smoke in the house. So I have to go on the balcony or go out to the cars or something, and so I get away.
Okay. Well, that is helpful for you a little bit. I can see how that would be a stress relief for you to be able to, get out for a few minutes from all these people that live here in the home. But I am concerned because smoking is bad for your baby when you're pregnant. Do you know anything about that?
I mean, I hear it, but I mean, like everybody I know smokes, and I mean, I smoked with the other kids, and I mean, they're fine. I mean, they don't they're not having disabilities, or I mean, Bobby kind of sucks at school, but I don't think it's because I was smoking.
Right, understandable. Well, I wanted to talk to you still about it a little bit. Do you know anything about nicotine and what it does to your body when you take it?
I mean, I've heard that the babies can be small, but that's about all I know.
That is true. One of the main ingredients in your cigarettes is nicotine, and that's kind of the addictive drug that's in them.
Yeah.
When it goes into your bloodstream, it can cause your blood vessels to constrict or get smaller.
Okay.
Which means your heart has to work harder to be able to pump blood. So when it goes to the placenta, it doesn't get all the nutrients and all the oxygen that your baby needs through that to get through your blood to the umbilical cord and your baby.
So that means like the baby can't breathe?
No, the baby is still able to breathe, but it's just not getting everything optimally. Does that make sense?
Okay, so just less than, like if it...
Right.
Okay.
It's getting less than the nutrients and the oxygen than it would if your blood was going through the placenta and your blood vessels normally.
Okay.
I brought you some information today. Some is from the Mayo Clinic and some is from the March of Dimes, which is a charity that helps to prevent birth defects.
Okay, I've heard of them.
Okay. Well, in case you didn't have internet access, I did print it out for you.
Okay.
There are a lot of effects from nicotine and smoking. Like you mentioned, having a low birth weight baby. It can also have a higher risk for miscarriages or stillbirths, which I know, unfortunately, you have a history of having a few of those, right?
So that could have been from the smoking?
Wouldn't maybe blame it on it, but smoking can contribute to that, yes.
Because they never told me why that happened.
Yeah, well, sometimes they don't know, but it can definitely be a risk factor for it. Some of the other things that can cause birth defects, like a cleft palate and a cleft lip. So those are
Is that
things
why their mouths are funny?
That's correct. Yep. Those are things that can be prevented if you stop smoking. And I know right now, especially for you, that's going to be really, really difficult. Makes it a little bit harder because it also is not a good idea to use a vape or nicotine gum, because nicotine is the drug that is the problem that can cause the issues. But there are some things that we can do to help you if you are interested. Can I give you some more information about that?
So there's something else I could do besides vape or chewing gum or something.
Well, if you look at the information I gave you, there is a list on here of some tips and tricks to do, and it'll be right there
Okay.
on the paper if you want to look at that later.
Okay.
And we can also find out some maybe other ways that you can do a little stress relief, maybe some meditation or relaxation. So it'll give you another option other than just smoking a cigarette. Does that sound okay?
Yeah, I mean, obviously, if I didn't realize that the baby could die from this or something. So that's a concern. I mean, it's going to be really hard to quit, though.
It will be very, very hard. I can give you some other resources the next time I come. We can print them out, or if you have access to the internet, there are some YouTube videos with hints and other websites that I can give to you too.
Okay. I mean, I'm willing to figure it out.
Even if you can't quit completely, just cutting down is really going to help a lot.
But if I quit all the way, then I probably take all those chances away.
Your baby is going to be a lot safer, and you will be much more likely to have a healthy baby. Yes.
Because I'm already considered old, right? Because my kids are old.
A little bit. And that does add a little bit more to your risk as well.
Okay.
But so far, everything looks good, and you're really healthy, and we just want to keep it that way.
All right. Well, thank you. I'm open to those other suggestions that you talked about.
Well, good. Okay. Well, I will come back and visit you next week, and I will bring you some more information.
Cool.
Okay?
Thank you. I
All
appreciate
right.
you coming.
Thank you very much.
Thanks.
Bye.